Welcome to this online module on capabilities in practice. What are capabilities in practice? Capabilities in practice, also known as SIPs, are the high-level learning outcomes of the curriculum. They describe the professional tasks or work within the scope of a curriculum. SIPs are based on the format of entrustable professional activities. They utilize professional judgment of appropriately trained expert assessors, so clinical and educational supervisors, as a key aspect of the validity of assessment. They provide a defensible way of forming global judgments of professional performance. To understand how the capabilities in practice are mapped to the curricula, it is important to know that the position specialties have been split into two groups, which follow different training pathways. Group 1 specialties are those that dual train with internal medicine, and Group 2 are those with a single CCT. For more information about training pathways, please visit the JRC PTB website. The capabilities in practice for Group 1 specialties are grouped into three categories. Generic SIPs, which are those that cover the universal requirements of all specialties as described in Good Medical Practice and Generic Professional Capabilities frameworks. Internal Medicine Clinical SIPs, which cover the clinical tasks or activities which are essential to the practice of internal medicine. And Specialty SIPs, those that cover the clinical tasks or activities which are essential to the practice of that particular specialty. The capabilities in practice for Group 2 specialties are grouped into two categories. The generic SIPs, which are those that cover the universal requirements of all specialties, and the specialty SIPs, those that cover the clinical tasks or activities which are essential for the practice of that particular specialty. You will notice that internal medicine clinical SIPs are not present. This is because these trainees do not dual train with internal medicine. Within the curriculum, you will notice that each SIP is further broken down into descriptors, the expected levels of performance, how the SIP is mapped to the relevant generic professional capability, and the evidence that may be used to inform entrustment decisions. As you read the curricula, you will notice that each capability in practice has a set of descriptors associated with that activity or task. The purpose of these descriptors is to indicate the minimum level of knowledge, skills, and attitudes which should be demonstrated. The descriptors, however, are not a comprehensive list, and there are many more examples that would provide equally valid evidence of performance. Here you can see an example of a capability in practice. This is generic SIP 1, able to function successfully within NHS organisational and management systems. The descriptors for this SIP can be seen here. You can also see here how the generic professional capability framework domains are linked to the capability in practice. So for generic SIP 1, you can see here that there are links to domain 1, 3, and 9 of the GPC framework. There is also suggested evidence that trainees may draw on to demonstrate capability in this area. In order to complete training and be recommended to the GMC for the award of CCT and entry to the specialist register, the doctor must demonstrate that they are capable of unsupervised practice in all SIPs as detailed in the curriculum. For more physician trainer resources, please visit the JRC PTB website.